Aku apa tip siapang cumi. Gak kemen pat. Apa nom si kelayang ah?
Kikubor Kapatisi TV.
Together we achieve, together we can fly, reaching for the sky.
ICFA University, Meghalaya.
Kublai shiboni pi baro akiba pek ya ganega program jongi ka Batisi TV. Hakaba menta ka singing inia keren shapang ka jingpang met ka jingpang Budlum bat kata ka jingpang Orthopaedic. Kaba ka ktha shi ka de ya ka kot khia jong brio habangi prakhat shisian prakhat bat kiwei kilat ki bang inia keren menta kilong hapdeng ki jing sumar. Kiba don kat do gani jai ki bangila ban ai shagi bri bayo gani jingpang met bat kata ka jingpang Orthopaedic ni don menta ban ni Dr. Deep Ghosh ide Orthopedic ibade Dr. ba kerpang shapang Budlum. Doctor, thank you so much for being with us. Yes. Can you tell us about your specialization in orthopedic surgery?
Thank you again for calling me, and it's a pleasant weather in Shillong. So basically, I'm an orthopedic spine surgeon with knowledge of all the branches of orthopedics. So first I did my MBBS, and then I did my MS orthopedics, and then I did my fellowship training in spine surgery. Along with it, I have short-term fellowships in joint replacement and arthroscopy and trainings. So might be my post-MS training is even longer than my MS training. It's around 5 years.
So you have had a tremendous experience in this field.
Actually, if you see, back pain is one of the most common disorders afflicting humankind. After, say, common cold and cough, everybody has back pain, not might be at the same time, but in different times. So there are a lot of causes of back pain, and some are very simple causes, and they not one need not be greatly worried about it. But there are some symptoms of back pain that might portend that it's a disease of a higher complication. So it's a wide range. So some back pain, it's okay, but if back pain persists, and there are certain red flag signs and yellow flag signs, if they persist, then it's a bad kind of back pain. You need to get investigated. You need to visit a doctor. We have developed from quadrupods, means from four-legged animal to two-legged animal. So that evolution, now the entire weight of the body falls on the spine. So spine slowly, because one of the organs, it slowly becomes degenerated with time. So there are discs, they become bad. There are bones, they become, they deteriorate. There are ligaments, etc. They are the most common causes of the back pain. These are the aging process. And there are other causes of back pain. Might be sometimes you can have infection, sometimes you can have infection like TB, tuberculosis. Sometimes you can have even tumors and even cancers also. Sometimes it could be as a result of arthritis. That's an autoimmune disorder. The immunity now doesn't block your bacteria and viruses that come from outside, now start damaging your own tissues, and they are part of this. So there's a variety range of things. So the common thing is that degeneration that takes place with time. So if you see people of say 18, 20, they generally don't tend to have back pain. By 30, 40, 50, they have a significant amount of pain. Almost everybody has this and that back pain. After that, again, it reduces, again it increases. Now, since at the age of 60, 70, the bones become weak and you start to have more pain again.
Now, when you talk about treatment, some pain are just minimal, where it does not require any treatment. But when it requires treatment, what are the kind of treatments that are available in these days with this technology?
So first and foremost is that simple back pain that lasts for 2-3 days. They can be tackled by home remedies. Like you take some painkiller small, or put a balm, put some hot water, take some rest, they go away. But if it persists more than 6 weeks, 8 weeks, these are bad pain. If the pain is associated with fever, if the pain is very, very severe, if the pain is such that one cannot walk, if there is weakness of the legs, or some very unusual symptom, that pain as such that at night he or she has to go, she has to wake up. These are bad pains. Now, once we have this pain, this range, we generally tend to investigate. Now, investigations mainly first is X-ray, and then is the MRI. From there, we get to know what is the problem, where is the problem, and sometimes you have a variety of blood tests. Some specialist tests might be needed in case like TB of the spine. So these are very rare, but what is more common is say slip disc. So you can have slip disc in the back and you can have slip disc at the neck, and it happens because back is mobile. Now
Right.
above it you have your thorax, and with the rib cage it is again stabilized. So you don't tend to have more disc problem there. Again in the top you have the neck, which is very mobile. You nod, we are nodding, we are talking, we are smiling, we always move our head. So these are the two mobile portions, and these two mobile portions in between the bones there are discs. These are like cushion like things. Now this cushion like things, what happens if there is a lot of pressure etc., and with some genetics also involved, they tend to come out. They become collapsed and they tend to come out. It's almost like a tire.
Right.
The structure is almost like a tire. Inside is not here but a gel-like thing. So it comes out, now it comes and hits the nerves behind. The problem is the nerves is that it is very irritating to the nerves, and there's a physical blockade. Like if it's a nerve and you press it, you feel symptom. That symptom you have it with the slip disc. So around 80 to 90% of slip discs are generally treated conservatively. At least body can make some management. Even 5 to 10% of that disc, if it shrinks, the body can work with it. Very rarely the disc is so big and so unrelenting that after conservative treatment, or if there is causes some very severe weakness of the hands or the lower limbs, or sometimes they have problem in passing urine or stools, and in case of males it could be impotence also. So those are the cases where surgeries were entered, and in the surgery we go and take out the disc. Now disc that can be taken out, this the conventional is to go for an open process and then dig into it. Now that's the old conventional process. In some, but we have our advancement now. Now you do microscopic spine surgery and also endoscopic surgery. And endoscopy is kind of, I regularly do it, and I'm kind of pioneer in Northeast to do that. So with endoscope is like with a kind of tube of 4 to 5 millimeter and some of 7 millimeter tube. That's a very thin tube. Even one is a 10 millimeter tube. Just one centimeter finger or even half of a finger. We go inside, we target where the problem is. We go through such area that there's no damage to the body, the muscles, the nerves, the bones, and we dig in and get out. So that's initially was a say 10 centimeter incision. Now it's a 4 to 5 millimeter incision. So that is the real advantage and advancement now. But with caution, I would like to tell that not every patient can undergo that. Now that we have to assess.
Can undergo the endoscopy treatment?
Not all.
No.
There are certain cases which are not good for endoscopy. Means there are certain technical problems. If it's a very disc that has gone very up or down and this, and there are multiple levels, these are treated by microsurgery or conventional surgery. So that is an assessment that a surgeon has to make, that this can be done. So many of them can be treated with endoscopy. If there is a disc in the MRI, it doesn't mean that you have to undergo surgery. That's the common mistake people make, and a lot of, I might not say unscrupulous people and unscrupulous surgeons make it that if a disc, you go for surgery. No. This there is also way. The body has a, spine surgeons have been here for last 40 years. What was there earlier? Body always has a healing process out there. In those very rare cases when it exceeds the healing process, then we are there to intervene.
Doctor, what are the signs then, that people should look out for when they get a sign, before they get that pain, before it becomes severe?
See, always everyone has got some nicks and cracks. So, if the nicks and those cracks and those back pain is troubling, 1, 2 days, 3 days, now that is the time one should be careful. On the 4th day, If you sit more than 3 to 4 hours, one has to get some problem. Other thing is that during that time you should a bit exercise and stretch up. Sometimes doing these small things can relieve that pain and cannot. But sometimes even with our best measures and best hopes, sometimes it might not come that way. And that if that is the situation, then for a few days you take 1 or 2 days of rest and take some home remedies. Generally 80% goes off that way.
Yeah, we've been talking about the pain, but it can be there can be a difference between simple muscle pain and the bone pain.
Yes. There are
What are the differences?
There are certain things. See, these are known as the ones in our parlance. It's on the red flag and the yellow flag. See, if the pain is associated with fever. Number two, if the pain duration is more than 2 weeks. If the pain is unrelenting, like from the morning to night, he or she has pain and no relief or very little relief at a time. If the pain is associated with, say, some posture, if he or she lies down, she has pain. If he sits, she doesn't have pain. These are the things. Another thing is there's weakness of the legs or upper limb. Those are the things. Or some unusual behavior, like you have jaundice and you have back pain. Certain like things like that. So you have some back pain and in some part of the body you have severe pain. So those are the things. It's like abdominal pain and then also back pain. So that might indicate there's some problem that is extending to the abdomen and also the back.
Can you discuss about the diet people should take, where normal people and people who are suffering from these kind of back pain, doctor?
See, one of the common things in back pain nowadays is the deficiency. Now, deficiency, one might be a bit obese. It doesn't mean he or she has got nutrition properly. One of the things is that, we live in a society now where we are not exposed to the sun too much.
Yes.
In houses now it has been replaced by apartments. So with sunlight comes vitamin D, and vitamin D being less nowadays, we will have those problems of low vitamin D and associated weakness of the bones and that thing. One is that. Number two is the quality of the food. So now there's not fresh food is coming. All these are in refrigerated. So the antioxidant, etc., those things, they get kind of reduced. So we have now kind of food that is more high in calories, but less in quality of the varieties of micronutrients that are available, vitamins, etc. So it's a very controversial topic, but I think we'd recommend more of multivitamins and vitamin Ds and calcium regularly. Though this is a very controversial topic and research has not found much of a difference, but sometimes in medical sciences it's very difficult to get research properly but that has been our experience all throughout, that if we give multivitamins and vitamin D, etc., they do no harm, rather they give much more benefit to the patient from back pain, etc. Even a course of vitamin D reduces back pain in a significant number of patients.
Now let's talk about scoliosis.
Scoliosis first is a bending of the spine. Generally it's sideways bending, that is known as scoliosis. Sometimes it might, sometimes there is a forward bending, that is known as kyphosis, and sometimes a combination of both, that is known as kyphoscoliosis. So kyphosis is just bent like this, hunchback. Scoliosis will be bent on the sides. So there are many causes of scoliosis and many forms of scoliosis. The most common form of scoliosis is in females in growing child, that is from teenagers, from 11 to say 19. This is known as adolescent idiopathic scoliosis. Boys are also affected, but predominantly around 60 to 70% of females are affected. Now they are very impressionable in an age where they are growing. Their parents have a lot of hopes on their kids. The child is at 7, 6, 7, 8. Just they have their menarche, that is passing of this menses. This is a very big biological milestone. They start growing fast and then they start having this. So what happens is a lot of parents don't have an idea what is it. They get scared. And remember that like everything I told, not every scoliosis needs surgery. If the scoliosis angle is less than 40 degrees, it can be managed with belt, etc. The thing is that with belt we don't prevent it from 40 degrees to come to 0 degree. It won't happen that way. But with belt etc. we try to manage it within 40. There are some cases where we do surgery. If the angle is more than 40, around 50, if the patient has respiratory problem, or sometimes they are associated with neurological problem, weakness, paralysis, etc. Those are the things. And in very young kids also we have, like in 4 to 5 years of age. These are very difficult to treat. And now I'll come to focus on arthritis.
Right.
Okay.
Let's.
So basically, what is arthritis? Arthritis is pain and inflammation in the joints. Arthros means from the joint and from the Greek word. And these are the joints. You have the large joints, the knee, the shoulder, the elbow, and small joints of the fingers, like the foot. So they can be involved. Now there are various patterns of arthritis. Some that happens with aging, that is osteoarthritis. Now with time, like your hairs get gray, your eyes, you have cataract, your skin becomes loose and shabby and shaggy later on. So you have this thing, your joints become bad. That is known as osteoarthritis, and it's most commonly affects the knee. That's one. There are certain arthritis that can involve with some metabolic problems, like you have high uric acid levels, high some kind of oxalic acid. There are certain things. The third kind of arthritis, that is a very prominent arthritis, that is rheumatoid arthritis. So these are autoimmune arthritis, this group. So what is autoimmune arthritis is that the entire body, everyone has immunity. Immunity is the function of the body to prevent infection mainly. So it can be bacterial, virus from outside. So it comes, you have a cut, that bacteria comes in. It's an immune system that comes in and tries to clean off that bacteria, and the body tries to repair. It's a part of the reparative and healing process. But sometimes those immune system go rogue. Now they don't stop the intruder, they start damaging their own cells. Now their cells, one of the favorite targets is the joints. There's a layer around the joint, that's known as synovium. They affect mainly those parts, and the enthesis, that is where the muscles and ligaments get attached to the bone. These are the favorite points. So once they have, you now start have joint pain. There are other places like in the eyes you can have, in the skin you can have. So you can see there are some persons having whitish spots. That's also part of the immune system. There are some patients who can have some kind of colitis, etc. in the abdomen. That is also the immune system attacking that. So now once that thing happens, now the joints starts to get damaged. And sometimes it goes so overwhelmingly intense that the patients are paralyzed, and sometimes even it can cause death. So it can go to that extent. Another form of this arthritis, and this is what we commonly find in Meghalaya, that is SLE, systemic lupus erythematosus. But some genetic factors are there involved. So this is another bad kind of disease. It affects the skin. They have rashes here. It affects the kidney, it can affect the brain itself, and it affects the joint. They have joint pain. Another type of arthritis is ankylosing spondylitis, where you have joint problem and also the spine is involved, but the spine can become very stiff. It's very painful to look at them. They cannot move their spine, they are hunched back like this. They cannot walk properly. The hip might get fused, means there's no movement at the joint. It's like welding the joint. It's a biological welding of the joint. So that's a very thing, but now there's so very good medicines we have come in. They are doing very fine. With this medicine, they almost act like they're normal.
Okay, then doctor, let us go on with the treatment of the fracture in a person's body. Can you describe fracture first?
Yes, actually, basically, so that's our bread and butter, fractures. For orthopedician, any bone gets broken is a fracture. So it could be your bones of the long bones of your hand, of your forearm, arm, the thigh, the legs. So nowadays with this motor vehicles going very fast, the bikes, where one is exposed to every elements and going very fast, 100 kilometers, etc., or 150. Now, when they have accident and impact, there is a lot of bones are fractured. So now the thing is that from an individual bone, it is the entire body one should be careful. So one might have head injury, one might have abdominal injury, and also fractures, multiple fractures. This is known as polytrauma. So they have to be treated very well. They have to be transferred rapidly to a well-equipped hospital. They have to be resuscitated, given IV fluids or blood, etc. The pressure should be made normal. Now you have blood here and it's broken, all goes out. You don't have blood in your body, so you need extra blood. You need extra saline so that can be replenished. So once you have that, then comes the means what if they have brain injury. So the neurosurgeon comes in. If the abdominal injury, the GI surgeon or the general surgeon comes in. Now for the bones, we have the orthopedician. So initially, if there is a fracture that is exposed to the skin, to the elements, like it's dirty, then we do a preliminary thing. Then we might have to go 2 times, 3 times. We might have to take the help of plastic surgeons, etc. And then coming to my focus on spine surgery, fractures to the spine can be sometimes very simple, and more often than not, it can be devastating, life-threatening, and life-altering. See, you have our brain here, and from the brain, all the information goes up and down to the nerves of the neck, the back, and then your lower back. So now that's the primary, it's a spinal cord. And there's something about the spinal cord is very, very sensitive. Injury to the here, if you have a cut here, it gets repaired. If your bone is broken, it tries to repair, even if no surgery, nothing intervention. But this is one thing that doesn't get repaired. The body cannot repair the spinal cord by itself. So that's a big thing. Sometimes patients have paralysis because of the nerve injury, and they remain forever. Whatever good treatment.
What about infection in this fragment treatment? How long does it take?
Infection is another kind of bugbear. Bone infection, once they are infected, it's very difficult to eradicate. Fractures, you have open injury. Means once they get infected, within 3-4 hours they will get infected, and after that treatment is difficult. Sometimes some infection occurs like in spine, TB spine. Now we find it more common in Meghalaya because of, again, cold weather, closed environment, because in winter you cannot go out. So that air circulates. Somebody might have a tuberculosis and that might spread. And sometimes it's because of lack of immunity, you have now this tuberculosis. So this tuberculosis is such a disease that can hold in entire part of the body except your hairs and nails. It can affect any part of your body, even your intestine. The lungs is there, this is the predominant. Even the bones, the hip joint, the knee joint, the ankle joint, name it, you have it. One of the very serious type of tuberculosis, the spine. Now once it happens, the problem is that now spine is near to the spinal cord. That's a very delicate organ. Now you have this, the bones are involved, they start to crumble, they will create an angulation, and they will start, the pus etc. start hitting the spinal cord. Now once the spinal cord is hit, the spinal cord becomes weak. Now they are not functional. Now you can have patients who have paralysis etc. So again, the dictum, and it's because of a great Indian surgeon known as Dr. Assam, that not all spine TB patients require surgery. There are few, this is known as middle path regimen. There are few cases where the infection is too much, or where you don't get a diagnosis, or there are certain where the bone is bent, then we undergo surgery. So always, like in arthritis, never stop your medicines until your doctor has said that.
So these are the precautions that patients should take while recovering.
And also good food, etc. Shillong had the sanitarium, TB sanitarium in northeast India.
Right.
It was the only sanitarium. It was because good food, good rest, nutrition, and a good state of mind. That is a pleasant state of mind helps it, and exposure to sunlight and fresh air. The treatment now is much more tailored to the patient. They will find it much more friendly to them. There are a lot of options out there. The costs have increased, that's a different thing, but the technology has increased a tremendous amount. Now this Northeast India is not behind the mainland India, not Guwahati, even Shillong. They have very excellent medical centers out there. The quality has improved a lot. say last 20 years, the healthcare treatment in Northeast India has increased a lot. So they can take care of and certain other states like Arunachal Pradesh, like Nagaland, Meghalaya itself, and Tripura, there, and Assam also. All the way facilities have increased in a great way. And so my advice would be to come and visit your doctor for your. You do not go outside and say spend a fortune and initially try to gather that fortune, and so your disease becomes worse. So come here and have a treatment. Might be a lot of people will be benefited now.
Ti katu kalong kajingkran jongi but I Dr. J. Deep Ghosh iba on batay binia hakanur kom ngila ba ladadon kum gini gija jingpang jonga met landi jong Budlum kinu jingpang arthritis ngila ban contact ya I Dr. Ghosh iban ai ke jingmut iban ai ke jing selok batni lani bat kinu gibri ba shem jing hakani galiang. Dr. Ghosh, can you tell us how do people get in touch with you?
So basically, I work in hospitals in Guwahati. One of them is the Apollo Hospital, and I have my personal chamber in Christian Basi, that's on the GS Road in Guwahati. So you can have my number and my assistant's number. So we both pick up the phones and direct you back to our clinic so that you can have a consultation with us.
And the place where you're working at Christian Basti is not far from the main road. People can reach there.
Yes, sir, people can reach. There's a parking, everything is there, facilities are there for.
The Sajisian Kubleshbon give a pay Yaganiga program Jongi. Kubleshbon, thank you, doctor.
Thank you.
Mornings are always busy. Everything feels fast. I hear mom shouting and I'm trying not to be late. Outside, Shillong is already awake. Cars move slowly, horns are loud. It feels like everyone is in a hurry. Then the STEMS bus comes in, bright and yellow, always on time. The caretaker waves and I feel okay. Inside, we laugh and sing. We share snacks, we help each other with homework. It feels nice. My parents know I'm safe through the STEMS app on mom's phone. Because this bus isn't just a ride. It takes us to school, with friends, and a little bit of hope. This is STEMS, our ride, our future.